I'm Dr. Morris at Magnolia Medical Center. I'm here with Cheryl. Say hi, Cheryl.
Hi.
So I was talking with Cheryl this morning. I just asked her about how she was doing. She's been coming in and getting treatment for. What did you come in and get treatment for?
My left knee was giving me great pain and I couldn't really walk.
You had this morning. You had said that I think you told me that your niece referred you in. Is that right?
Yes, Miss Holly.
And she told me a great story about that. We'll save that for another day. But she told me about how her niece referred her in. And do you mind if I tell them a little bit about the history you told me about?
Absolutely.
So Cheryl had in 2019, I think you said she'd had a heart attack, and then there's Whitney walking behind us. And then after that, due to some peripheral artery disease,
Yes, sir.
she had an amputation to your right leg, and then she started having pain in her. She was having pain in her left knee.
Correct.
And she went to orthopedic, and the orthopedic told her that he didn't want to do a replacement. Told her it was bone on bone. She saw the x-rays. Didn't want to do a replacement on it because if it went badly, then she was going to be out 2 legs. She's already out 1, and she didn't want to have the risk. And I think rightfully so, good decision that the orthopedic made to not do the other knee. But then she's been suffering, not walking, not enjoying time with her husband, and really just not getting around very well.
Yeah, and the pain even at night just to lay down was just excruciating.
Were you losing sleep?
Yes, sir. A lot.
So, and then not that long ago, you came in and we started
6 weeks ago. This is my halfway point.
Okay, so you've been coming in for 6 weeks. You've been getting some what we call CET treatment, which is combined electrochemical treatment. You sit down on these nice recliners, and we do some very benign, very like just into the soft tissue, some injections of vitamins into the tissue around the knee in your case. And then we put you on a device that helps bring blood flow and reduce pain to the area. And we've also been doing some injections of hyaluronic acid.
I love it.
Yeah, so just basically providing fluid back into the knee to give some space and give some lubrication back to the knee. How's it been doing since?
It has made a huge difference. I don't have the fear. When I stand to walk, I'm not afraid that left leg is going to go out from under me anymore. It just is a strengthening issue for my leg.
That's awesome. Now, you had said that you're out walking with your husband again.
Yes, sir. That is correct.
That's awesome. Is he happy about that?
Very.
Now, something that as the owner of the clinic, I'm pretty proud of is our staff. And you were telling me that you've enjoyed them quite a bit.
They are first class. I have not run into one of them that I would not want for total care for me in any situation. They know you by name when you come in. They act like you're the most important person.
It's because you are.
That's in their care right now. And I've been very profoundly impressed by the way they act and behave. Their bedside manner is just absolutely impeccable.
Well, that's awesome. So, good care and good results. Is that right?
Absolutely.
All right. Well, thank you so much for sharing.
My pleasure.
Tell everybody on here to give us a try.
This is the place to come if you want to get well.
All right. Well, thanks, Cheryl. We appreciate it.
You're welcome.